Hey folks, Dr. Steve Garber here. Today I'd like to talk to you a little bit about knee pain, which is a condition that we do effectively treat here at the Garber Chiropractic Center. To understand knee pain, we have to discuss the 3 D's of knee pain, and that would be disease, degeneration, and dysfunction. And of course, if there was any disease within the knee, such as a tumor or a cancer, or even as a result of trauma, a fracture, we would refer you to an alternate healthcare provider. And that would be determined through a comprehensive examination, which would include x-rays. That aside, the next thing we would look at is degeneration. Due to age and wear and tear and abnormal or improper weight bearing on the knee, the cartilage can wear out. If we take a look at a knee model, we look at it from the front, we have here what is called the lateral meniscus, and here is the medial meniscus. And if we look at it from behind, again, the lateral meniscus and the medial meniscus. That's basically the cartilage lining of the joint, and it lubricates and prevents direct contact between the 2 bony surfaces. It can wear out. It can become pitted or knotted, almost like a pothole that you would see in asphalt pavement. And that pitting can become extremely painful, and it can also reduce the range of movement in the joint. The knee should be able to easily flex, slightly extend, and rotate in both directions. And as a result of degenerative changes, those movements can be minimized, making the knee very painful to move or very stiff to move. How do we treat it? Well, we do a combination of mobilization and adjustments, as well as stretching and strengthening exercises, and when necessary, different forms of muscle stimulation. One additional and very effective thing that we do is called long Y-axis traction, where we actually take the knee and just gently open it, close it, open it, close it. It stimulates transfer of fluids in the knee, increases circulation, and promotes healing. It's very effective for knee issues. And of course, if it's advanced and bone on bone, we're going to be very limited in our ability to help you. But if it's mild or moderate, then we can do a lot for you. The next would be knee joint dysfunction, and that's the inability of the knee to properly go through all of its ranges of movement, making it stiff and painful to move. To properly evaluate that, we have to look at what's known as the kinetic chain, and that is the effect of all the joints in the lower extremity, and particularly how they are affecting the knee. So if you remember the old song, the foot bone's connected to the knee bone's connected to the hip bone. A lot of truth in that song. When we evaluate the knee, we must look at the foot and its function and how it's related to the knee. And we must look at the hip and its function and how it's relating to the knee. So we basically take a global approach to make sure that the whole lower extremity is functioning properly. Again, how do we treat knee joint dysfunction? Well, very similar. It's with a combination of adjustments, mobilization, stretching and strengthening exercises, muscle stimulation when necessary, and long Y-axis traction to open the joint, increase circulation, keep fluids moving, and promote healing. Through the years, we've been very effective in helping many people with knee problems. So you're probably wondering, can I help your knee problems? Well, the only way to know is to come in for an appointment. So here's what I'd like you to do. I'd like you to call the number on this screen and set up a no-charge consultation where you and I can sit down together, discuss the nature of your knee pain, and see if you can be helped through chiropractic procedures. If you have been x-rayed, or if there are CT or MRI scans of your knee, please bring them with you and I will read them at no charge. So stop suffering and let's see if chiropractic care can help you. Give us a call today. Take care.